joining us today. We really appreciate you taking the time and making this happen. We know this is a challenging time, so we want to make sure that we're giving information out as quickly as we can, and we appreciate everyone's patience. As I said, if you have questions, please use the chat box or the raise your hand feature, and we will do our best to respond to those, and then also to develop a frequently asked questions document afterwards. This is being recorded for folks to view later and listen later. So just a heads up on that as well. We are, and there is captioning available for those who may have just joined us. There's captioning available, and if you go to the chat box, there's instructions on how to do that. So I want to do a quick introduction of county and state partners on the call. So my name is Susie Strummel. I'm with King County Developmental Disabilities and Early Childhood Supports. Megan and Branda, do you want to introduce yourselves?
Hi, I'm Branda Matson. I'm the Employment and Day Unit Manager here at DDA.
Hi, I'm Megan Burr. I'm also with DDA on the Employment and Day team. Good morning.
Sung, do you want to introduce yourself really quickly?
Hi, Sung Cho from Developmental Disabilities and Early Childhood Supports. And if we could support the CART function by speaking clearly and slowly, that would really help subtitle this well. Thank you everyone for joining today.
Thank you. Jessica?
This is Jessica Lee with the Whatcom County Developmental Disabilities Program.
Trish?
Hi, Trish McConaughey from Clark County.
Great. And Ben, are you on with us as well?
Yeah, Ben Martin with Snohomish County Developmental Disabilities. Good morning.
Good morning. Are there other county partners that would like to introduce themselves at this moment?
This is Angela with Total Living Concept.
Okay. Brian, I thought I saw maybe you were on the line. Maybe not. Okay. So I think we put together Trish McConaughey, actually, County, had reminded us yesterday that we are looking at a motto for this time period, or she's looking at a motto for this time period of being responsive and flexible. And I think that that's a really good motto for us all to remember as we're moving through this process. Again, I know there are a lot of challenges, there are unanswered questions, and it seems like things are changing by the hour, well, by the day or by the hour in some cases. So just trying to really support each other as we move through this process. And that's what we wanted to get this webinar out and get information out as quickly as we could. And Branda, with that, do you and Megan want to talk a little bit about the intention of the tracking spreadsheet?
Well, the overall intention is that we want our providers to stay healthy and whole. We don't want staff to be laid off. We recognize that revenue may be lost, and we don't want that to get in the way of an agency having to close its doors. We want, we see this as an opportunity for agencies to potentially educate themselves more and also remain viable.
And I would just add that we are so appreciative of all the good work that folks are doing, that we are trying to be as responsive and flexible as possible. So bear with us. We're building the plane as we fly it. So there's a lot of versions of spreadsheets and direct out there because we wanted to respond as quickly as possible. But we also have to make sure that we're in alignment with our funders, Centers for Medicare and Medicaid. So do apologize, know that this is a stressful time, and our intention is not to add any stress. We just want to make sure that we are responding in real time, as Branda was saying, to make sure that we keep you guys healthy and sustainable.
Perfect, perfect. And I really want to echo the tracking spreadsheet actually came from an idea out of the provider community of ways that agencies were looking at tracking the time loss. And so we happened to have a Community Employment Alliance meeting that was scheduled for just about a week and a half ago, and that was a standing meeting. So counties were already talking with providers and DDA, and we decided to try to implement that on a statewide level so that we would be able to really track what was happening for folks. And as Brenda said, trying to mitigate those impacts. So it's a short history on the PowerPoint. It is a very short history. It's only been about a week and a half that we've all been working on this. And the timeline would be to track services from March 1st forward. So I think at the county level, really want to echo the thank you to providers. You all are doing an incredible amount of work working with individuals and their support teams and families to try to keep information coming out and support folks in this period of a lot of change and a lot of unknowns. Also really want to thank our partners at DDA and the other counties for being so flexible and working together really, really quickly to try to mitigate impacts on our whole service community. So just a thank you on that. I think, Jessica, we can go to the next slide. Okay. So Brenda and Megan, do you want to talk a little bit about the update of where we are in the process for the spreadsheet and those kind of pieces?
So let me back up a little and just give you some oversight or overview of our engagement with CMS. On the 15th of March, we sent a formal letter to them requesting that we, under the 1135 waiver piece, that we basically, which is whenever as you go into disaster mode, you can ask for a waive on your waiver, in short. And so we've been in constant contact with CMS and have actually submitted what's called an Appendix K and an 1115 and an 1135 to make modifications to current services quickly. This is for a short period of time, which is, I believe, a year, and then we can possibly do it again. Hopefully we won't need to. And just today, we were approved to do the remote billing. However, we do have to track it separately for CMS. They're going to require all of that backup document whenever this is over. So I just want to put that up front first. It's unsure whether, and this is kind of into the weeds, but you'll understand as we go through the presentation. It's unclear as to whether the startup funding that we'll be using will be matchable or not. We're hopeful. They're considering that. And what else can I say?
I just would add that when Brenda said was just approved, she means 30 minutes ago. So I just want to frame for folks on the call that we're doing the best that we can to provide timely information, but this is what we have today, and that may change,
Right.
That may be nuanced, but that is why we developed this tracking spreadsheet. Is I think it's imperative that we are able to tell the story of what we're doing, because we're definitely going to be asked these things. Just to frame it and connect it to why we're asking folks to track this information is this is hot off the presses, 30 minutes old, and we don't have all the details yet.
Right. And I just, the importance of our partnership and even negotiating or putting out the spreadsheet is kind of, I think, kudos for all you, and because everybody else is going to have to ask for an ETR or prior approval for remote services. And I argued that since we're tracking this, why would we go through that process? So they have to do an ETR and or prior approval as well as track this. So I'll leave it at that.
Yeah, which speaks to, again, the work we did with our partners, counties and providers alike to start this conversation quickly. I would add, just because this is so evolving so rapidly, that I would encourage folks on the call who are not signed up for Gov Delivery notifications to consider doing so. That's the official mode of communication from DSHS. In addition to that, if you go to the main website, dshs.wa.gov, there's a whole page of COVID-19 related communications that are housed there in one place.
Okay. We'll hand over the intent of the tracking process.
Okay, thank you. Jessica, did you want to talk a little bit about the spreadsheet? Or do you want me to talk about the intent?
Well, I think Branda and Megan mostly just captured it, which is the only thing I guess I would add is there's potentially different funding sources that DDA is going to be accessing, which is why the spreadsheet we're going to look at in a few moments is so complex. And so really, that's really just the understanding is that because this is exceptional, there may be documentation requirements that are not typical. And again, really want to thank the providers who were involved in helping counties in the state develop the spreadsheet. So I think looking at the document itself is going to be easiest to really talk through some of those details.
Great, thank you. I think it's important to note that not all counties are on this call, and that was a decision that was made at the county association meeting this week. We discussed this, and because we had limited space and only 100 spaces on the Zoom call, they really wanted providers to have that access. So it's really important that if you have questions, you follow up with your county coordinator or county contact after this meeting. And I know some counties have meetings already set up, provider meetings either today or next week, conversations with folks, but please do follow up locally with your county coordinator if you have questions, because they may not be on this call and many of them know this information, but they'll be observing the Zoom call after the fact and looking at the recorded version. I think we had a couple questions just to kind of understand your current state in the provider community. We are asking that you use the raise your hand feature in Zoom for the question of how many providers have already laid off staff as a result of the COVID-19.
And if you're having trouble finding your controls, just jiggle your mouse. And under participants, if you click on participants, I think some people's screens might look a little different. If you click on participants, there's currently 98 people on the call. You should be able to see that raise your hand feature if you don't immediately.
And when you click the raise your hand feature, then Trish from Clark County, who's monitoring the pieces, will be able to see that too. Okay. Trish, did you get a count on that?
5, 6, 7.
We appreciate your patience, everybody. This is part of the responsive and flexible piece. we actually haven't done a Zoom meeting quite like this as counties, so thank you for that.
Oh, 8 now. 7. I'm seeing 7.
Okay, great. So second question, how many providers are considering staff layoffs? If you could do the same thing, use the raise your hand feature. Trish, are you getting a separate count for that? Sure. I want to give you time.
There's 4 considering layoffs, so I'm just counting.
Okay. The raise your hand feature, if you click on if you kind of jiggle your mouse and click on the participants, like you'll see there's 98 participants right now. If you click on that, it will show you the raise your hand feature. Okay, 13 providers considering layoffs. Perfect. And just to let folks know, we're not going to hold you. Somebody said, I misunderstood the question, it's okay. We're not, we're just trying to get a feel for where folks are at. So separate question, will this support and what you've seen of the spreadsheet and what we're sharing in terms of the intent is really to help support provider stability and support you with the average amount of billing that you've done for, well, the last part of the fiscal year. And we'll explain more about that. But do you feel like that will help with this process?
So great comments in the chat box. Thanks, everybody.
Yeah,
I think that
helpful.
helps.
Yeah. Okay, good. Good. Okay, it means we're on the right track then. That's good. So appreciate that.
17 hands saying that this will be helpful.
Okay. Okay. So Jessica and Ben are going to walk us through the spreadsheet, and I'm sure DDA will chime in with pieces as well. And I know there are some questions specifically I've heard, and it looks like in the chat box around startup hours. So we're going to do our best to explain those in the best way we can and in the most simple way we can. And then we'll definitely take questions because we know that that's a big area of question for folks. So Jessica, do you want to start us off?
So again, repeating, I know that there's been a lot of versions that have gone out there, and ultimately your county coordinator is going to be sending the final version for you to complete with the monthly billing. And so I'm going to attempt to go through this tab by tab, but I guess I wanted to start, let me actually just start this way with this other document. Just a sec. So are you guys seeing a Word document right now? Is that?
Yes.
Okay. So I just wanted to
Jessica.
start. What's that?
Sorry, this is Megan and Brandon. We just really quickly before you jump in wanted to clarify. It looked like there was some concern that startup funding may not be approved. Just wanted to clarify it's the funding source we'll use for it. We are supportive of those activities. Under startup, it's just what funding source we bill.
So startup is typically 100% state only, and we have the resources to support through this time. What I was trying to allude to with the March 15th letter from Washington to CMS was we were asking for them to allow us to match the monies for the startup funds. So it's part of why it's separate from the remote. They're still wanting us to track the remote, and they're considering whether they're going to match the startup. That's the one thing we're waiting on. But there's revenue and monies available to support all agencies through this. I just want to make that clear.
Start there.
Yes. And I think I just wanted to start, I think, with the idea that startup, all that refers to is a spending category for DDA. So startup is basically a cost center, and that's why it keeps on being referred to it as startup. So I just want to start with how you guys are documenting and the monthly billing. So typical monthly billing activities are going to continue, right, as they have in the past. So you'll continue to document the typical billable activities in the client notes. And Brenda and Megan have referred to these remote or time-limited activities, which are the typical billable activities that are done remotely and that are not typically done remotely, such as remote discovery. Really, discovery is typically done in person, right? So those time-limited remote activities also need to be documented by client in the log notes. And we are asking you all to note them as such. So on that client activity log, you'll have your typical billable activities, and then you'll have some way of noting that these other activities are the time-limited remote activities. So both of those, both the typical and the time limited, are going to be included in the total on your monthly billing to the county, right? You're just, again, we're going to be able to see in the log notes which one is which. So in emphasizing that those remote activities are approved on a short-term basis, this is not a permanent change, but it is a temporary approval. Okay. Let's see. Let me move that off. Okay. So there are multiple tabs to this spreadsheet, depending on which version you've seen. So I included a summary tab, and there's a lot of words on this. And again, once we do this, once you all have gone through the spreadsheet once, we'll have more information about what works about it and what doesn't. But we wanted to provide a summary tab so that you guys can assess where you are in terms of documenting backup hours versus hours you're requesting for reimbursement. So all this really does is it takes totals, which we'll look at from the what I'm going to call program spreadsheets, individual employment, group supported employment, and community inclusion, and brings them forward into this summary spreadsheet. This is locked. You can't edit this. This is just a way for you to kind of double check that you're on track and what you're asking to be built, what you're asking for billing is you have sufficient documentation for, okay? And I've got some notes here about, like in this example, there's 21 of those of startup hours, which are these exceptional hours we're looking to bill for, but there's only 2 backup hours. In this example, this would be a no-fly, this would be a no-go, because we need sufficient backup documentation to equal what the hours are that you're asking to be paid for, if that makes sense. Again, we can come back to this tab after we've reviewed the others to make sure it makes sense. So let's go into individual employment. And all the tabs look fairly the same. So the columns on the tabs are going to be the same. All right. So A through F or A through E are typical columns that you guys can populate. Date out for the month, date back in for the month just refers to, let's say the client works for the first 2 weeks of the month and then the employer has closed or the person is quarantining or whatever that COVID related example is. We just want the start date and the end date for that client in terms of their activity with employment services. Column F is we need to know who is making that decision to not participate. Was it the client and guardian? Was it the employer? Was residential staff? This is a drop-down menu. So we've tried to build in as much as possible, make it easy. So residential employer, provider, staff, or other are the options, okay? This next tab, so this is kind of the basis of how we're calculating hours that we're allowing you to bill, is this column reflects the average hours that you have billed to the county for this client from July through January. And Megan and Branda at the state office are going to be generating some resources, some spreadsheets. Megan specifically is going to be doing that. Yay, Megan.
It's generated and out with the regional employment specialist. So
Okay.
Be your way today, counties.
Okay, so regional staff will get that to county staff, and then county staff are going to need to create spreadsheets specific to each provider. So there will be a little bit of time to do that work. But that's a resource to be able to put that average in this column And what we anticipate is once you have populated this with those average hours, that's not going to change. That's the average we'll be using for the duration of this process. If you, as a provider, believe that the totals are not accurate, or that you, at this point, this is the conversation we've had as a group. So some of you have access to data. I think we're willing to have you all use your own data, with the caveat that it has to be hours that were billable to the county. It can't be anything that was over the max, for instance, right? It has to be those average billable hours to the county. I think the idea being that if you had a client out for 3 months, actually, let me, Megan, do you want to talk to that a little bit?
No problem. So I think in discussions, we want to make sure that it's representative of what's, I like the word typical. Average is another way of saying it, but you may have an anomalous month in there. So if Johnny's stable in his job has been the last 6-7 months, but he had 1 month where he was out for maybe a medical operation, that's going to drop those typical hours. So I think we're open to what is typically provided. It just needs to represent, again, those typical hours of support that were provided in the last period of July through January of fiscal year 20.
And we recognize some people may come in late or whatnot. So again,
Right.
that's why we're just focusing on
Yeah.
fiscal year 20.
Yeah. So again, the data that I provided counties is just one tool, one resource. There's not going to be a perfect silver bullet. I think it's taking a look at all those pieces and what makes sense. Like Branda said, you may have someone that was early into service. You may have someone that typically receives supports that look like one thing and there was an off month, and we would want to support, again, what is typically provided.
Okay. All right. So column H and column I are the hours we previously talked about, which are the things that are going to be appearing on your monthly billing. Those typical billable hours and those time-limited remote hours, right? And so several of these columns are locked and are formulas. So once you enter these, once you enter column H and column I, that's an automated total. And so this column here that I'm highlighting, this should equal, column J should equal what you are billing to the county for the same month, correct?
Correct.
So that's a way to verify that we're kind of on the same page around how you're documenting, okay? Column K is also automated. This is an automated column, and essentially it's taking these average staff hours here and reducing them by, or basically getting the difference between what you're billing and what your average is to really get that difference. What is that difference that we're trying to essentially make up? If you typically build 10 hours and you're only able to come to 4 hours for that client, we're really looking at trying to determine what are those missing or hours that are different than what is typical for that client. This is just, again, this is also a locked column. Again, your county is going to be changing this rate here, up here. All of you may have different county rates slightly. And this just automates the rate that whatever that your county chooses. So the question I'm seeing is, this spreadsheet will not replace your typical billing. This is in addition to your typical billing. So the challenge is we have an automated system with the typical spreadsheet that gets uploaded to DDA, and upon which you all are paid through the Provider One system. This process this is a separate process that will not be uploaded in the same way. So this is a separate document and process. So this is where we're eventually calculating what is the cost, what is that potential revenue that is being lost to you due to COVID-19 reasons. So startup, here's this word startup again. So really this is a kind of, this is all the calculations. This really is summarizing what are the actual hours and dollar amount that you will be requesting for reimbursement related to COVID-19 activities, right? Or COVID-19 reasons. This is automated. Again, this just pulls this number over. It is not locked, however, at this time. We wanted to give you guys some flexibility because we're needing to, again, I'll show you this. We're needing to make sure these numbers match. We just don't know all the circumstances that you all are dealing with, and we wanted to build in some flexibility because ultimately we're needing the hours you're requesting for reimbursement to match the backup hours we're going to be talking about that you need to document, okay? So group supported employment and community inclusion are the same. We're actually, the next step in the process is going to be very similar to how we think about group supported employment, which is you have staff hours that are shared and may not be specific to a client. So let's go to here. So this is where we're asking you to essentially document basically organizational and personnel development hours that you can't tie to a client. But these are the types of hours we're trying to pay for to make up your difference, right? So these are hours that, so hours in training that can't typically be tied to a client. I'll pull down the list here, okay? And we can talk a little bit about these, or I can have some of our partners talk about these. But this has to be by staff member. We're really saying what were the specific hours that were invested in and paid for by your agency that can't be tied to a client, that are related to services and benefit your organization, either improving services, improving staff, or building your capacity as an agency. So it includes staff name, activity type, and then we are asking for a very brief description. So of a mandatory training, you know, your staff engaged in some sort of training, give us a brief description of the type of training. Start date and end date. So if it was something like training, you would have the same start date and the same end date. Round to a quarter hour as typical. And then this last column is only for certain types of activities. I think the intent is that we want you to be prioritizing professional and organizational development, but in the event that you can't find enough hours in organizational and professional development, we are allowing that opportunity to identify staff who are on paid leave related to COVID-19 reasons, right? So if somebody's going on vacation, that's not going to be documented here, but we wanted to be able to document, get you guys up to the total number of backup hours so that we can pay you for that difference. And so in this instance, let's say we have somebody who's out for, down at the bottom, they have COVID-related paid leave. So they're in quarantine, for instance, the date they left, the date they returned, and again, you would put the end date of the month that you're billing for in this instance. And then we have two, well, this has been modified a little bit, so that there's either been no change in work status, or they're on the, most of you I'm sure are familiar by this point with the shared work option that is through employment security or for partial unemployment, right? If you have laid someone off, they're not going to be appearing on this spreadsheet, okay? And so this is where this total all, you've got training, you've got file review, preparing for CARF. Some of you may have CARF scheduled already. There are activities in preparation for CARF. There are meetings like this with the county and the state to understand and prepare for COVID activities. You probably will not be doing a lot of Chamber of Commerce functions because of restrictions for large groups, but any sort of other development that is not specific to a client. Working on strategic plans, doing customer satisfaction surveys, by phone with folks as you check in, doing quality assurance review of client files, updating electronic client files to make sure that they're complete and up to date. So you're going to get a total here, and this may need to get expanded depending on how many lines you have. But this is the number that we pull over to this spreadsheet here, right? And essentially what we're saying is you can't request more hours from all the summaries from these two tabs. So we got the summary here, I got 5 hours, right? We've got all these summary tabs. This subtotal, whoops, so but there's locked, there you go. So these have to be equal, and you can't be requesting more hours for payment than you can provide supporting documentation for. All right, did any of my team members want to add anything that I missed on here in terms of description?
I would like to add something on B, individual employment, if you can go back to that one, Jessica.
Yep.
And you hit on it all. I just wanted to reiterate, as I've seen some questions come through too, that J, column J is your total hours you were billing under your 4 phases. The time limited will be documented in your case notes so we could monitor that. And we need you to pull those out of your case notes and put those numbers there. And we did talk a lot about how difficult that can be and time consuming, but we have to have those hours. We have to have that documentation. So the I is already in the 4 phases. You're just pulling that out. What is extra? What is time limited remote? So we know and have those numbers. Thanks, Jessica.
Okay. And so Trish, do you want to summarize any questions you're seeing? And some of these, I'll be blunt, I've seen a couple of questions come through. Some of these we may need to bring back together as a team so we have consistency around it. Because just building the spreadsheet has been task enough. Any other questions, do you think, for clarity, Trish?
Yeah, there's a number of questions, and I think that we should just try to get through as many of them as possible. And then I think that we'll be able to use them kind of as a frequently asked questions. So I'm just going to launch in.
Okay.
So about the average service hours I'm sorry. Let me start over. Will this PowerPoint be sent? Yes, it will go out to the county coordinators. There's a comment, I think this would help, but if this goes on, are we just pushing layoffs out until later? Does somebody want to field that?
The intention of this is to support our agencies not to do that. So I'm not understanding the question. Is the question, do we have enough revenue to keep going? Yes, we do.
Okay. Just wondering about people in DVR. Will DVR hours included in the average hours that we're comparing?
No. That's
No.
Don't bill for DVR hours on when submitting billing to DDA. So no, those average hours would not be there.
Does a virtual check-in require a screen, or can it be done by phone? Not all clients have screens.
Either.
But we would encourage at this time, we, if there's any way to help a client actually set up, if they have a phone but don't necessarily have FaceTime or whatnot, that would be part of billing time and or time you could spend helping that client do virtual things. The other thing I want to mention is that the waiver, there's a $500 technology piece there where somebody could purchase a phone if they need a phone. So I think it's a good time to be creative. We did in the application have, I'm not using the right word, but it is phone and video. So both of those.
And we understand there may be rural parts of the state or county where Wi-Fi isn't as accessible. So phone will absolutely be okay. But I agree with Brenda. If there's the ability to be creative, then we would encourage it.
Yeah.
So Brenda, when you talk about the waiver, you mean the basic plus and the core waiver and community,
Yes.
I would assume, right? Okay.
Yes.
And folks, to advocate for that, the client or their support team would need to contact the case manager, correct?
Yep.
Okay, great. Thank you.
Okay, next question is, are remote and time limited interchangeable on case notes?
I think you should probably use both, because there may be remote activities that are more typical, like job development. So I would use both together on case notes, time limited remote. If you're specifically talking about like time limited discovery type things. Anything to...
Yeah, so part of this isn't typical, and that's what we're trying to catch. It isn't, I'm sorry, discovery is not done typically with the person. And so that is very typical. But just, excuse me, I mean job development. Discovery, yeah, what you said was typical to happen with person. I heard something else. I don't know, my brain is like already fried. It's really capturing the things that aren't typical. So that's what we're trying to capture. I don't know if that answers the question. Be consistent with what you do and be able to explain it if asked. Because I do know that the feds are going to require backup. And so we're going to have to distinguish between what was time limited and what is startup, those things, versus what's typical.
And I think that people can talk to their county coordinators too.
Absolutely.
About for additional help. Moving on, because we've got lots of questions. Average service hours. Will there be an allowance for clients who changed programs between employment and community inclusion, or who had extra hours?
That's an interesting question.
Yeah.
If you've changed to community inclusion, if the question is that, then you're going to go through an assessment and hours will be determined. And so those will be the hours you would need to use versus the average. Some
of these questions we may need to get back to you on.
Yeah.
I think that's why there was some flexibility left in those average staff support hours for situations like that, where it's maybe the last 6 months don't reflect the current situation, or there was a change in that 6 or 7 month period. And you guys know that, well, really it's the last 2 months that we should average rather than the last 7 months, right? So that's why we left some flexibility in that column for you all. You just need to be able to justify it if it's different than what's being provided in terms of data to the county.
Okay, moving on. Specific to people providing remote services, we still enter the dates they aren't working. I'm sorry. I'll have to get that back in the form of a question. Okay, I'm going to move on to the next question. What is the average hours time frame we should be using?
So July 2019 through January 2020.
Okay. are we calculating average hours? If DDA is, do we account for DVR hours?
No.
And is DDA calculating average hours, or are the
DDA.
There, Trish.
what's that?
I think this sentence got cut off. What was the question? Is DDA calculating the average hours, or is blank?
Or is the provider?
So DDA has provided a resource, but if the provider has their own way of calculating, I would work with your county coordinator on that. Again, this was just an additional resource that we handed out, but you may have robust data tracking systems yourselves.
But you will have to discount the DVR time if your robust system captures that.
Okay.
That's fair.
Will the CRIS report require columns H and I to be added together into job prep and job development, et cetera? I'm imagining the person is referring to the billable activities.
Yeah.
Yes.
Yeah, and I think Ben answered that. Yeah. Mm-hmm.
Yeah. Okay. We already answered this question. This additional spreadsheet will not replace the typical monthly billing. What if the client was not working but opting out of service? Do they still go on this spreadsheet?
They're choosing to stay home. I would assume it's because it's COVID related. And so I would assume that yes, their hours would still be counted in here as missed hours.
Right. The question is there a way to reduce our work, not have us break out hours by clients in startup and have that automated on tab A to pay for up to the loss but not over?
I'm sorry, but no. You have to do the backup. That we were on the phone call with the feds this morning, and they want it by client.
And
Great.
This spreadsheet would be covered under startup type activities.
Right.
So we know there's an increase here, but it is something that we would consider billable under those startup activities.
You're saying the completion of this, the work, the extra hours to complete
Correct.
this is billable as part of the startup staff tracking.
Correct.
It's time spent.
Okay, for clients who have been laid off, what kind of support hours are we expected to give them as they wait to go back to work?
What do you typically get? What's their average?
Okay. Question about column D and E. What do those dates mean?
Clients, what we've understood from our Monday calls from service providers are that clients are calling in and saying, we are not going to work beginning March 1st through X. And so it's being logged so that it's understood this client is not engaging due to choice, parent, guardian, employer says you can't come to work, residential provider says you can't leave, RHC says you can't leave, adult family home says you can't leave. So it's capturing that information.
Okay.
And it might make sense, sorry, just in column E, I understand there's probably a lot of people who don't know. He's not coming back for an indeterminate amount of time. So I think putting unknown or something like that is appropriate.
Or the end of the month, because they're going to be tracking this.
Well,
Yeah.
and I think this is, this is called building the plane in the air by committee a little bit. But I would think if we're billing by a month, what it might look like is for the month of March, you would have the end date of March. For the month of April, you would still have that start date in March, but well, I don't know. So the end date being the month that you're billing for, I think this is organized. I'm just trying to think about functionality of a spreadsheet and how to make this reasonable.
This might be one we can get back to you on.
Yeah, sorry.
It's fair.
I'll stop thinking out loud.
If Chamber and Rotary go online as well as guest presenters, would that go up against startup time?
Yes.
What rate would startup staff tracking be reimbursed at?
Jessica, do you want to, so it's, I'm pointing at the screen, but it doesn't matter.
That's a typical hourly rate.
It's the lost hours rate. So we're looking at individual employment right now. If you go up to the top of the screen, column O. So if, in this example, there was, I think, 3 hours lost. It would be 3 hours at 75. So it's at the typical rate of that lost service category. So again, while you're collecting those staff hours, if there was a total across these 3 sheets of 20 hours to make up, it would be associated, like if you had 10 of those hours on IE at 75, that would be the reimbursement back to you. Again, we're trying to fill the hole that potentially is there.
So I think I understand what you're saying. So it sounds like it would be helpful to add the dollar totals to this summary sheet perhaps as well. I think what we're getting at is I think the total hours,
But
and it
not the
depends on
dollars.
where those hours live as to what the reimbursement rate is going to be in terms of the that difference.
Correct. Yeah. Yep. Okay. Good input.
Can we work through DDA to get SME approval as an individual or agency for courses we can teach and offer for all agencies, so the SME is paid as well as the attendees?
Say that one more time.
Can we work through DDA to get SME, subject matter expert, approval as an individual or agency for courses we can teach and offer all agencies, so the SME is paid as well as the attendees? The subject matter expert is paid as well as the attendees. Contracting for training and technical assistance.
We already have SMEs through our technical assistance contracts, which would be WISE and Service Alternatives. So Service Alternatives contracts with people. If you want to be a person such as that and contract with Service Alternatives or WISE, you can. I know that I think it's in the release process or close to it, that we, all of the WEL and Washington Employment Leadership Network trainings will be online and available. So again, we pay for butts and seats. So you can sign up through WISE and get training there, or again, work with Service Alternatives.
Okay, I believe I read that on the startup hours that it was for direct support staff. You just said strategic planning. Can managers also bill their time?
No, that's not typical lost revenue. That's like, maybe we need to field that one. It's just not typical. We were originally focusing on direct service staff because that's how you bill your time.
Okay. Are the startup hours earned in 1 month to be used in that same month, or can they be carried from month to month?
Ooh,
That's a good,
that's a good
let's
question.
get back to you on that one. These are good.
Okay.
Yeah.
That one's a really good one.
Yeah, and I think we should develop an FAQ that we publish that comes out of this, because these are really good. So we'll work on something printed.
Okay, we have folks that have been at home due to the COVID-19, high risk, etc., but choose to work remotely instead of using sick time. Their ability to work a full schedule has been impacted by being at home under quarantine. Are those folks count as COVID-related lost hours, correct?
Oh my gosh, repeat that one more time. It's a complicated line. So it's staff that are homesick, but yet they're working. Their hours should count if they're doing typical work that they can track, right?
Yeah, and then those hours that might be lost, based on being under quarantine, would that be countable as startup?
Yes. You can,
Okay.
both pieces is what I'm hearing. You're collecting the work that they're doing, and if they're only working half time, then the other half, if they're not on L&I paid leave, that half time can go to the startup bucket.
Just really quickly, logistics piece. We're coming up on 11:30. We can keep going, but we are gonna have to stop recording soon after 11:30. We have captioning that I believe could go till 11:45 if we need to, but just a commitment that we will take all the questions in the chat box and make that part of an FAQ. But just also to let you know that those two pieces will need to shift soon after 11:30. So I just want to be transparent about that. But the captioning can continue till 11:45, and checking in with Megan and Branda. Are you all okay continuing a little bit longer and getting some of the questions? Okay, perfect. Thank you. Just wanted to let folks know.
Okay. Do you guys know anything about the rule that agencies need to use up their PTO first before they can access unemployment?
No.
Okay. So the difference that we ask for has to be less than the staff specific hours on tab E.
What tab?
So your total startup hours requested has to equal or be more than the backup hours you're documenting on tab E. Has to be at least
Okay.
equal to.
Okay. What are the things that can be under startup? Is it limited to the drop-down items?
No, startup's pretty broad in nature. This has been focused on direct staff and related to that. So clarify the question.
Is there a specific
Yeah, is there a
activity?
specific activity?
Yeah.
And there's the attachment that was sent out has a list of those activities. The date out and date back, is that referring to the client not working and be receiving support work? What if we are still providing check-ins with the client and employer and working on billable activities that can be done remotely? So does that mean that somebody isn't out if we're still working with them, or do you want those dates to capture any kind of modifications that we're doing?
That's a complicated question.
I kind of added to it, but it's asking the date out and date back. Do you want those dates to incorporate, even if staff are still doing check-ins, but the person is not working?
So they're checking in with the employer, and I would guess, and they're still going to track that as remote. So
yeah,
it would make sense that there'd be an out date there, and otherwise,
okay.
You're asking if they should be tracked at all, correct?
Yes. Yeah, those
they
dates.
should all be tracked.
Yes. Sorry.
Yeah. What are all the things that can be done under startup? Oh, we already got that one. Okay, next one. Keep going. Keep going. Updating client electronic files is allowable. How about going through old paper files and shredding?
It's pretty open. What we're hoping that professional development is prioritized and organizational development next. And then literally we're filling holes where hours couldn't be captured.
Okay. What about the clients who are nonverbal? How do we provide remote service for them?
I think you guys are going to have to troubleshoot some things yourself. I'm guessing that person may sign, and maybe that would be the option. You're going to have to figure out individually. There's not going to be a response to everything. You're going to have to also be creative and think about what's, we're trying to be flexible as possible, but also be as creative as you can with your clients and help them. Again, if they don't have the technology, try to help them get that.
Or maybe if there's some training or technical assistance the agency needs to learn how to do those things, there may be an opportunity there.
So there's a few other questions like that about training on a phone without being near the client. So I'm just gonna skip over that one because I think it's the same answer about kind of being able to get creative and figure these things out. I think that I would imagine that like any other challenges that we see with the people that we support, technical assistance, will be available.
Sorry, just
Okay,
one more
so-
interruption. I'm sorry,
Go ahead.
Trish. Just wanted to let folks know we are continuing the recording. We have the ability to go until 11:45. So just wanted to make sure folks were aware.
Great. Could you send info on the text waiver?
On
The waivers that Brenda spoke about earlier, I believe that stuff will be posted.
Yeah, it will be posted.
Yeah.
So you can.
And contact your case manager. Is that right?
Are you talking about the $500? Or,
Yeah.
Oh, okay. Sorry.
Yep.
That would be contact your
Yes.
case manager. The client, you need to work with the case manager. That.
Okay. Can you give more info, examples on documentation you are looking from us for the client remote hours?
I think we've outlined it here in the spreadsheet. It's indicating the day, the person it's related to, the activity that you're doing, and the time associated with it.
Okay. Will this support continue through the duration of the pandemic?
Yes. As far as
of
we
today.
know. If things change, or if they right up front, it was, you guys have to document this and expect that we're going to ask for it, that you're going to have to provide all the evidence that that revenue was lost, everything. And so until we hear differently, we're CYA.
Okay.
So Brenda, I'm sorry. On that question, when you say we have revenue for a period of time, I know you don't have a crystal ball. I'm just wondering, do you all have any thoughts about, I don't know. I just was.
Well, I am meeting with.
It's not just for March, I guess is what I'm saying. I'm just clarifying.
No, okay. And so we didn't address that. So it is March, and we'll continue to do this spreadsheet. I'd be using that same spreadsheet. We didn't touch on base on this. You continue to use this month after month. You don't necessarily have to update the average hours.
Right.
I am meeting, we have a meeting with our accounting department as well as the P1 configuration people to figure out how, because we built this plane and then we've said, okay, it's got to fit into provider one system because it has to have special codes associated with it. Is it, here's our vision, is this going to work? And so it may change after that meeting. I don't think so. I hope not. If we get word that, as an example, that that the startup is matchable. I don't know that it'll have to, maybe that'll move to a different line. I don't know. But I do know they're going to require documentation.
Right. So for the moment, folks will continue to do this way of documenting services. And as things get updated or change, we will get that information out as quickly as possible. Correct?
Yep.
Is that fair?
We don't like adding administrative, it's like administrative make work, and it's not our favorite thing to do either. We get told what we need to do and try to figure out the easiest way to implement. So we're just trying to be flexible, but make sure that you all remain viable.
Right. And I think it's fair to say nobody has a crystal ball, and as things continue to evolve and develop with the pandemic, we'll be communicating with folks through a variety of sources, including your county coordinators. Is that?
Yep. We've got our Monday calls and now our Wednesday calls. Weekly.
All right. 7 minutes.
What is it thinking now?
And I will just add quick, I mean, I'm seeing a lot of questions about DVR. We do need to figure out how to bring in our DVR partners, because we know you guys also have DVR business that is going to be impacted and revenue from DVR. So I believe, and Branda can say more, but those questions are going to have to get answered by DVR.
Exactly, and this is Terry Redmond with Employment and Day Unit, DDA. And I'll be working with DVR to get some of those questions answered. So I believe there's a meeting scheduled with providers shortly here. The date hasn't been confirmed officially, but I'll be on that call, and I'll be having meetings with DVR to discuss how we can maintain the viable providers, because obviously they need the providers as well to be available and able to do the work.
Do we want to take a few more questions?
We've got a couple more minutes. Sure.
Okay. So typical means normally done with that method. Remote activities are typically not done. Does that do not? I think this question we're gonna have to get back to. Okay. What type of remote hours are we able to do with our community inclusion clients?
Like what type of activities?
Yep. What type of remote hours are we able to do with community inclusion clients?
Discovery is a great one.
Mm-hmm. Planning.
Okay. If this extends beyond March 31st, do we still put March 31st in the day back in for the month? When we record it for April, would we use 4/1 for the date out for the month, even if they went out on 3/15?
Hey, I think this may be something, I think we've had a lot of questions about start dates and end dates
Yes.
for the staff and for this. I think we might need to do this in an FAQ because I think it's fairly dense.
Yes.
Would you agree?
Okay. Yes.
Yeah.
But what I was going to say is what's most important is the service month date in column B1, that be correct, because this represents the billing month. And so less important is the start and end date. It's just, we know that providers are tracking that, and so thought it would be helpful information.
Okay, can we bill for assisting a client with applying for unemployment?
I'd be inclined to say yes.
Well, and isn't there's a lot of new opportunities through Department of Labor and Employment Security and new processes and navigating that for job retention. I think that seemed absolutely appropriate and directly connected to COVID.
Okay, what if a new client started February 1st, 2020, and you billed a significant amount of hours that would equate to a significant funding loss? Those hours would not be captured in the fiscal year 20 July through January averages. Is there a way to use startup hours for those clients?
Again, we're going to have some individual unique situations where that is your average would be what's typical. So what did you provide the previous month or the month before? And what do you stand to lose? So I think you're going to have some one-offs that you're just going to have to be logical about.
And probably connect with your county and talk
Yes,
about
definitely.
those.
Okay. We can use startup hours for clients that are not working in job development, skill building, et cetera, correct?
Because they're unable to engage in employment type activities. Yeah. I think
Well, wait. So this question is asking if for clients that are not work, I'm sorry, we can use startup hours for clients that are not work in job development, skill building, et cetera. But if they're doing job development and skill building, then that should be billed under the typical category.
Right.
Right.
Yeah.
I think just most of this stuff is what's typical or what would be logical, because that's all we're going to do is apply logic.
Is this a monthly sheet, or will we continue to enter running data in this sheet over the next few months?
You're going to have a sheet for every month, but you can use the same sheet. So you're going to have to copy it, but because it'll have to be a standalone. And I'm thinking of that for it when and if the feds say, we need the backup, so we're going to have because one, it's informing what you're billing, so you're going to need it for each month. But two, you don't necessarily need to recreate the data. You're just going to enter the new for the new month, meaning what staff hours took place.
Right.
Okay.
I apologize, but we're going to lose our, we're losing our captioner, and we're going to need to stop the recording. So just want to check in with folks.
Okay. And so we will get an FAQ out with the rest of these questions.
Right.
Correct. Correct. Thank you all. Does it make sense to end there then, and with the commitment to know that we will get the FAQ out?
Yes.
Thank you.
Absolutely.
Thanks to everyone for all your attention to this and your work, and thanks to all our partners for everything everyone has done. We'll continue to be in communication with you all as things continue to change, and update you all as quickly as we can. We had updated 30-minute old information from CMS this morning, so that's pretty good. So. Thanks to everyone. Have a good rest of your Friday and a good weekend.
Thank you.
All right.
Good
Bye-bye.
weekend.